Hi, hello, welcome everyone to medicboyvlogs experience the bread of nursing. This is Ajay Gulshan here. This is the first time I'm trying to do this video totally, completely in only in English. Uh, I'm just giving my best to speak in English, but so sorry if I speak really worst English means please pardon me. Okay, today's my topic is I have passed my Kenntnisse prüfung. I think the person who are all trying to coming to Germany, you all know that you need to clear Anpassung Lehrgang or Kenntnisse prüfung if you have a partial Anerkennung. So today in this video I am going to explain you about how I have passed Kenntnisse prüfung and what are the things that I have covered and what are the syllabus, and I'm just going to give you a small review so that you can able to get some idea and you can able to get some insight about this. So hope you will understand everything and hope you will like this video. First of all, in this video I'm going to explain you just simply about Kenntnisse prüfung structure, because most of them don't know about what is the structure of the Kenntnisse prüfung. The Kenntnisse prüfung is nothing but a knowledge exam that offered from employer to the nurses who are coming from abroad. So in this exam it contains mainly of two main parts. The first part is the mündliche Prüfung, the oral examination. In this examination, two examiner will be present there and they will examine your skills, how far you have enough knowledge about the disease condition, how far well you can able to good manage the situation. This is the first thing. This is the mündliche Prüfung or oral examination. Then second thing, that's the nothing that the praktische Prüfung, that is the practical examination. So here comes the tougher one, because most of them will have some of like stress and some kind of fear with the practical exam, because it's really quite challenging. You have to do everything, every procedures so exact and so correct. Most of the time in not only in Germany, in any country, we have learned something, but we will compromise the things while working. Like in some aspects, we will compromise the things and we apply that in our daily routine. So it will come subconsciously from our mind, from our daily routine to the work. So it will affect your scores and it will affect your rate. That's the important reason and the important fear behind the praktische Prüfung. But the thing is, Übung. That means you have to do more and more exercise to correct you in the praktische Prüfung and to work further with good quality and to work further with without getting any interruption. What are the important things you have to learn in mündliche Prüfung is nothing but the disease conditions like Herzinfarkt, Schlaganfall, like morbus Crohn, Parkinson's. Then like there will be around 20 conditions. It may varies to 30 to 40 in some scenarios, but there will be around in my scenario there is around 20 conditions. So we have to prepare ourselves with this 20 conditions completely. We have studied this 20 disease conditions. Nothing new in that. It's the same which we have learned in our home country. Maybe it differs. In my home country India, I have learned that in completely in English, and here I am learning everything in German. That's the difference. In the mündliche Prüfung, in the oral examination, you have to talk according to the Bescheid. That will be you will receive, if you receive a partial Anerkennung, that will be a Bescheid, like how far you have to be tested, like minimum 15 minutes to 60 minutes, like minimum 1 hour to 2 hours. You have to talk about the conditions, and the examiner have to come to a decision. Okay, he or she have the enough knowledge about the content, so we can able to pass him in the mündliche Prüfung. So this is the thing which the examiner will notice from you. And in this mündliche Prüfung, they will ask about the disease condition. First of all, they will give a case scenario like Mr. X has admitted in a hospital in a Notanfall, that means the emergency room. In the emergency room, how far Mr. X can be treated and how far Mr. X can be. What are the nursing aspect? What will you do? Medicinal aspect? What will we do? How will you assist the doctor, and how will you play a good role as a nurse here and help to save the patient's life? Like, these are the things they will ask in the mündliche Prüfung. What are the Pflegemaßnahmen? Like, what are the nursing measures you have to do in this place? These are all the things will be covered in mündliche Prüfung. And praktische Prüfung, they will give you a patient. The patient may be that's depend upon your bedside, how far you have to take care of the patient. For me, there is only one patient they have given from inner, that means inner medicine. In inner medicine, I have got one patient. I have applied my practical skills upon that, and I have tested by two examiners. They are also nursing personals. They examined me. So in this scenario, you have to do your practical skills, like starting from pflege anamnese, collecting the informations from the patients, and compiling some important things. After collecting these informations from the patient, you have to give the things to your examiner, and you have to start your pflegeplanung. Pflegeplanung is nothing but nursing planung. This nursing plan I have done around five or six nursing plan I have done, and I have given the nursing plan to my examiner. My examiner checked everything and gave a Xerox copy to me. The next day, it's actually a 2 days examination. First day is only of collecting information. You can also do your nursing procedure and everything, but there will be no examiner in first day. They will come and they will examine you, but they will not stay with you they will not accompany you total day. But second day, they will be there, accompany you in a total day. How are you working? How far you are good at your hygiene? That means that the hygiene aspect, how far you are good, they will look at that closely. So you have to be very careful with the thing. Then the procedure, how far you are doing the procedure right, how far you are doing the each steps very right, they will surely notice the thing. So you have to plan some nursing measures, and you have to do your nursing report, nothing but the pflegeberichte. You have to write that. You have to prepare the medicines under their view. You have to prepare every medicines, and you have to give to the patient. So be careful with before eating medicines like pantoprazole. This is a Magenschutz. You have to give that before your examination, before the patient's Frühstück, that means breakfast, and you have to give the other medicine after Frühstück, the breakfast. So some things you have to be very careful with that. You have to do communication so good. You have to communicate always, and you have to explain each and every step to the patient. I am doing this one. I am doing this one now. Like I am doing corporate pflege. I am doing now. I am going to give you medicine. In corporate pflege, each and every part you have to explain everything to the patient. And after giving everything, after doing everything, after checking and everything, you have to finally give your Übergabe to the Übergabe, in the sense you have to give handover to the nurse there. Then that's the thing. And finally, the examiners will accompany with you in a reflection section. In this reflection section, I will give you a best tip. If you done anything wrong and you have noticed the thing, means please tell the thing to the examiner. So I have done this wrong. I know the thing, but I have done this wrong. Maybe of the exam pressure, maybe. So you have to explain the thing to the patient, to the examiner. So that's a plus point for you. So you can able to show you, okay, you are aware of that. Okay, so like that, these are all the things you have to be remember in a practical examination. So this is only a first part. If you are really interested to know more about kenntnisprüfung and what are all the contents that are in, I am so happy to do a part 2 with the elaborative manner. So if you really like this video, just give a like, and if you really need a part 2, just give me in a comment section part 2. And if you want to reach me and if you want to talk to me, then please mail me your number to medicboyvlogs@gmail.com. So I'm happy to share my experience with you. I'm so happy to share my knowledge with you, so we can able to share our knowledge. And I found that's really a very good thing. So please like the video and share the video, and don't forget to subscribe to Medic Boy Vlogs. Bye.